All right, everyone. How you doing this week? It's end of week 9 here, and I just want to get this weekly video out for you guys, a little update on the recovery process, and we'll just jump right into it. So for this week, my goals, got my computer over here, just reading off the slides here. So was to reach 130 degrees flexion, and also working on achieving that full active extension. For the flexion side of things, I barely made it on the last day of the week here. I hit 130 at PT. I got to about 126, which is where I've been kind of sitting the last week or two. And then my PT helped push my leg further. It was pretty high pain level, relatively. And with that, I got to about 128. Then we did some exercises to kind of warm me up a little better, I guess. What's the thought process there? And then I came back to the heel slides with the strap, and I was able to hit about 130 exactly. So it was a buzzer beater, but I did it in the end. So feeling pretty good about that one. So the full active extension. So I don't think it was totally realistic for me to hit it this week. I am recording this the day after, like into week 10 right now. But you know, today I'm starting to feel like I'm getting there just about to full active range of extension. But during week 9, I wasn't there. And I think I'm pretty close still, but just kind of working on that. That's kind of like a barrier for a couple next progressions on different exercises and cardio things and whatnot. So getting that is pretty crucial. I think I'm lagging a little bit in terms of maybe the standard timeline for things, just because I lost a lot of my muscle already, and I'm at a deficit because I didn't have huge muscles to begin with before I tore my ACL, and then I didn't really hang on to it too well after I tore it before surgery. So that, coupled with not walking, being on crutches for 4 weeks, and then 2 weeks without partial weight bearing. So I'm at a deficit right now, but I'm getting pretty close to having the full extension back, so that's pretty good. So next week, my goal is just to get that full extension, hopefully. Just work towards it at least. I think maybe I can do it. We're gonna have some modifications next week to kind of help me get there. And also just working on the flexion. So I don't think I'm going to reach, aim for a certain measurement per se, but just keep working at it, keep pushing it. I think I need to, at least once per day or once every other day, kind of really push it to where there's some higher pain levels, just to kind of keep moving it. And I think the rest will kind of come with time over this rehab process. So that's what I'm looking for the goals here. Again, as usual, pain levels is touched on every week just because. No pain really. The only time I really feel pain is really the range of motion, the flexion work. Otherwise, really no pain. Maybe first time introducing that exercise, which I'll cover in the next slide. There's some discomfort, maybe low level pain. But usually the second time, it's like next day when I'm doing exercise again. Usually I've got no pain with a new exercise at all. But yeah, just no pain really, except for, as I said, working range of motion, maybe a new exercise, a little discomfort. And then my knee is still pretty stiff. It's getting better and better. I think I'll start to maybe not be as exponential with the ease and stiffness, for lack of better words. I can't think right now. But, it keeps progressing every week, so that's pretty good. And yeah, so that's that for that one. Just want to touch it every week just to update you guys. So exercises and walking. So the home workout plan with Elite Endurance Physio, Josh there, is the same. We kind of had already planned out that these 2 weeks will be about the same here. Nothing really changing. And I did use the blood flow restriction machine once every other day. And as I said, I'll probably be upping that for week 10 to every day. And maybe even multiple times per day. Probably like at least twice, if not 3 times, so I'm doing my knee extensions. But yeah, so not a huge difference there. As far as my ortho PT, we did introduce double and single leg presses. I didn't get any footage of that at the PT, but we got those 2 added in there. It's pretty low resistance. I think it probably equates like 60 pounds roughly, but it's instead of being like a traditional weight leg press, it's kind of like resistance bands and springs, so it's kind of hard to measure it, but be about 60 pounds roughly is what I was doing for double leg, I think, and then single leg was even less. We also did step down, so if I'm on a step on my surgical leg, bending down so I can tap my good leg, for now, good leg, onto the ground with the heel, and keeping, good form, not shooting my hips out backwards or, tilting my hips sideways, really working the muscle there. That one did feel pretty uncomfortable at first, the first time going around, but the second time, we've done it twice because I had only 2 appointments this week. It didn't feel quite too bad the second time around. It was pretty tough though, the muscle's pretty weak, but no pain or discomfort there the second time around. And on top of that, we did, on the last day here, do basically just sitting in a chair with wheels. And so while I'm sitting there, just using my legs to kind of pull myself forward and scoot around, a couple laps around the place. And that made me a little bit more tired than I would have thought, for my hamstrings mainly, I think. And that was just a good workout there. But nothing else besides that was introduced today, or this week, in ortho PT. And so walking still improving every day. You can kind of see me in this video, I'm pretty mobile relatively now, but just working on putting that heel out in front and kind of really doing a heel strike on that is kind of what I've been focusing on this week. And that paired with knee extensions is getting a little bit easier. But again, just stiffness is what's really holding me back, I'd say, less so than muscles and whatnot at this point. So yeah, nothing huge there. And then I got my high level goals for June, which just passed. It's now, time of recording this, it's July 3rd, but got some goals here I want to just lay out for next month. And it's kind of the previous goals that would have been if I worked with Josh at Elite Endurance Physio a little bit sooner. We kind of jumped in towards the end of June, so these goals weren't super realistic just from where I was starting at with my muscle deficit and the meniscus repair. This is geared a little bit more towards ACL solely reconstruction, no repair on the meniscus, but at this point now the restrictions on my meniscus are lifted for the most part, so this will line up with the ACL kind of protocol. And I'm just going to read off the screen here because I don't have it down in memory too well. But so June was weeks 7 through 9 when I started with Josh. It was around week 7, week 8 roughly. And the goals for that is to attain full knee range of motion, minimal to no fusion or swelling, progressing strengthening and neuromuscular retraining. So you should be able to perform a single leg partial squat, and then also a double leg hop in place without pain and using good form. The kind of prerequisite to doing the double leg hop was having full leg extension. I spoke with Josh on that one today just kind of see, if I kind of hit those goals for week 7 through 9. So I think I'm a little behind, but that's okay. Once I hit that full extension, we will kind of assess things on that front. And then so weeks 10 through 13, so July here. It's the month of July for me. The goals here is to hit a single leg squat to greater than or equal 60 degrees. So 60 degrees or deeper flexion for max reps, and greater than or equal to 80% of my non-surgical leg, so my good leg right now. So just hitting 80% range of my non-surgical leg and squatting to at least 60 degrees or deeper. That's kind of like the big milestone goal for this month. And there's some other things thrown in here because it'll be around a 3-month time frame in July here for me. So weeks 11 to 12, progress cardio workouts, so using stationary bike, elliptical, or swimming as tolerated. So I'm not sure I'll probably hit that just based on me being a little further behind currently. That's okay, but we'll be working towards that one. That's why I want to get that full knee extension as soon as possible. And then about 12 weeks is when usually after ACL reconstruction you can return to run, depending on the doctor's protocol. I don't think I'll be looking to start, when it's return to run, it's more like a jog for a couple minutes, and then walk and then jog for a couple minutes. But I probably won't be hitting that, probably a little bit later for me, just based on where I'm at right now, but we'll see. And then on top of that, there's a criteria that you usually got to check through to make sure you can start doing that. Just make sure you're strong enough and you're not going to put yourself at risk for any re-injury. But for that, it's pain-free single leg hopping 20 times, ability to perform greater than or equal to 9% of your non-surgical limb max reps for single leg squats. And that's again going to 60 degrees or deeper with your squat. And then having full range of motion for your knee, and no effusion or swelling. So those are some pretty big criteria to hit before you start running again. So that'll probably be towards the end of the month, closer to weeks 13 if I even hit it, but we'll see. I'm not in a huge rush just because I probably won't be getting back to sports immediately after, like the 6 to 9 month range. I'll probably wait even longer just to be safe. Since there's pretty good evidence about, waiting to a full year, even longer, you really reduce your re-tear rate. So really just getting back to normal is my main focus right now. So even biking will be a big improvement to my exercise routine. So being able to do some bike workouts will be pretty good. And then on the last thing here, so the mental challenges this week is just staying patient. It's pretty tough. Kind of sitting around a lot and doing these pretty minimal workouts with the PT. It's pretty hard just to slowly progress on things and not really start, amping things up because I'm feeling pretty good at this point. Just got to remember that slowly progress exercises to make sure, there's no discomfort, pain, no issues with the knee and swelling and ramping that side of things up. So that's been a challenge for me this week. It is pretty tough when you're used to being active all the time and do much stuff, and then having to, your routine turns into just doing some leg raises and other pretty basic exercises. And I don't know, that's been tough for me this week. Hopefully for you guys out there, if you're at this point, you're maybe a little bit further along and maybe starting back to some cardio and other things like that, and that'll help, release some stress and other emotions out a little easier. So yeah, that's it, guys. About to eat dinner now. So into week 9, thank you for watching. If you enjoyed this video, like, subscribe, I'd appreciate it. And I'll see you guys in the next video.